Afternoon. Thank you, Maria. Good afternoon. Before we begin, I would like to let everyone know that this session is being recorded, and these recordings will become available on our DentEcho website after session. And we are very happy to have all of you join us for the 29th Dental Education Network for Texas Echo, commonly known as the DentEcho. This session is brought to you by the UT Health San Antonio School of Dentistry. And I'm Kato, and I will be facilitating today's session. And Maria will be our wonderful IT support for this session. And Maria, if you could please share the slides back again with the pre-survey. Yep. Thank you so much, Maria. Yep, and agenda. Here's a brief look at today's session. We'll start with some housekeeping and introductions, followed by a didactic presentation and case presentation from Dr. Leach and Dr. Escobar. We'll wrap up with a Q&A session at the end, so please save your questions for then, or feel free to use the chat throughout the session. Next slide. And some housekeeping items for the session today. These sessions are recorded and will be available later on the DentEcho website, along with the slides. Please stay muted unless you are speaking. And we encourage you to use the chat or the raise hand feature to share questions and perspectives. And to help us track attendance, please enter your name, affiliation, and email into the chat. And remember, no personal health information should be shared in the chat during discussions. If you run into any connection issues, Maria or DentEcho IT is available by chat to assist you. Next slide. And for those who may be new to ECHO, this is a model that builds virtual communities of practice and learning. Sessions include a didactic presentation and de-identified case-based learning and group discussion to foster deep knowledge and build individual capacity. ECHO is an all-teach, all-learn supported model, and ECHOs thrive on the interaction from the full learning network, so we encourage everyone to participate in the conversation today. Next slide. And exciting news, DentEcho is moving to a new improved platform called iEcho. This will be a one-stop hub for all participants, providing a smoother and more streamlined experience. Participants will need to create an iEcho account, and we'll share more details in the coming weeks. We had originally planned to begin using the new platform this session, but we've decided to launch it at the start of our next session in January instead. It feels like the perfect way to start a brand new year. On a brand new platform. Next slide, please. And to receive CDE credits, please stay for the entire session. If you want to register for CDE, you can do so now using the link in the chat or by scanning the QR code you see here. When registering, please use the super code ECHO 2025. And next slide, please. Thank you. And let's go to introductions. Dr. Challa.
Thank you. And I'm Suman Challa, and the PI of the grant that supports DentEcho. Delighted to have you all here.
Thank you so much, Dr. Challa. And from the Hub team today, we have Dr. Dar, Dr. Marwaha, Vanessa, and going back to Dr. Dar, as you introduce yourself, could you please introduce the speakers for today's session? Oh, you may be muted.
Thank you. Good afternoon, everyone. It's our absolute pleasure to have Dr. Riccio and Dr. Escobar today for our presentation. Dr. Riccio is a clinical associate professor at UT Health San Antonio School of Dentistry and director of the International Dentist Education Program, drawing on her own IDEB background and 27 years of clinical experience to guide foreign-trained dentists towards US licensure. She teaches multiple clinical and patient care courses, mentors students across all levels, and promotes evidence-based, multidisciplinary, and interprofessional education. Welcome, Dr. Riccio. Dr. Escobar is a dedicated dental educator and clinician with a strong background in comprehensive care, digital innovation, and academic leadership. He earned his DDS degree from El Salvador, where he also taught predoctoral surgery courses and managed his own practice. He completed a 2-year AGD residency from our institute and following which he joined us in the faculty as an assistant professor and the director of the digital dentistry program. Welcome, Dr. Riccio. Welcome, Dr. Escobar. It's a pleasure to have you here, and we look forward to your excellent presentation. Thank you.
Thank you.
Thank you so much. It's a pleasure to be here today.
All right, Dr. Leach and Dr. Escobar, whenever you're ready, please share your slides and take it away.
Okay, do you see?
Yes, looks great.
We can get started. Thank you, everybody. Good afternoon. Thank you for being here. I have the pleasure today to talk about modernizing treatment planning, and I'm sharing this presentation with Dr. Escobar, that is really our expert in digital dentistry here.
Thank you so much. For me, it's good to be back. I did a session a few years ago with Dr. Yepes, and I appreciate the invite. For those who don't know, Dr. Riccio is my mentor. So to be here sharing this lecture with her, to me, is also very valuable. So I can't wait.
Yes, and let's dive in. So the purpose of this lecture today is mostly to explore with you all the possible tools that we have available to modernize our practice. In particular, what you actually experience as the first approach to patient care, that is the new patient exam. So everything that has to do with diagnosis, treatment planning, patient encounter, and all the tools that we have available to make this experience for you and for your patient more efficient. And also to understand what are the possible problems that you can encounter in integrating these tools in your practice, in your everyday practice. As you may remember from dental school, we tend to structure our treatment planning and diagnosis and treatment planning, our new patient exam, in 4 steps, the famous SOAP note that we always talk about. And S is the first step, that is the part where we collect the patient information through medical and dental history and chief complaint. O is objectives, is everything that we do in collecting findings, collecting data of the patient, and trying to gather all the information that we have through imaging, through CAST. And A is formulating as the assessment. So it's formulating diagnosis, collecting all this data. And P is when we actually do our treatment planning for the patient. We analyze all the modifiers of the treatment plan and how we can actually present all the alternatives to the patient that they have in taking care of their oral health. So in the past, the first step was done through paper records, phone calls. When we had to communicate with specialists for referrals, everything was done through letters, mails. Today, most of the offices have dental records that are electronics. And a lot of them, they have AI integration that help them to write notes, to dictate charts, and even to use other tools like scanners or cameras to identify data about the patient. And in more complex organizations like our school or military organization or hospital, we have what is called integrated healthcare networks. That is even like a next step for integration of dental records and healthcare records. And that helps a lot, especially when we are in clinic with students. Now that we are using Epic, we don't have to rely only on patient information, but we can see actually all the medical history of the patient, the medications that they are taking. And that's very useful for us. I don't know if you agree with that, but we really find that very helpful for us.
So Dr. Riccio was talking about the 4-step soap, and it's definitely exciting. It's exciting times to be a dentist because we have all this technology that has definitely transformed the way we practice. Before we used to do intraoral exams with documented papers, take x-rays, impressions, and cast, and now we have developed everything to go digital. So that allows us to be more efficient, save costs, and we'll see all the factors that play a big role with this. But in our school, we have digital x-rays, intraoral cameras. We'll talk about our intraoral scanners that help us a lot. And then now, instead of pouring up casts, we are 3D printing models. So I'm going to show you some cases where I just want you to see what we are doing, and maybe with the intention that you can familiarize with these cases and say, okay, this is what I can use, this is what I can apply. So in today's world, CAD/CAM is part of our routine. In the past, we would used to think that CAD/CAM was only tied up to the CEREC, but CAD/CAM stands for Computer-Aided Design and Computer-Aided Manufacturing. So this is what I teach the students. We all have to learn the new language as the career, as the profession evolves. We as clinicians have to evolve with it, and that and knowing the right terminology is something that is important as well. Some doctors tell me, well, I don't do digital, I don't do CAD/CAM, but what they might not notice is that sometimes they're sending a cast or an impression that is being digitized in the lab, and it ends up in this CAD/CAM workflow that we live in. So this chart is important, especially for today's presentation, because you don't have to have all these tools. You don't have to have all these expensive equipment to understand the workflow. So this chart tells you how we get from A to Z, either going analog, fully digital, or maybe a hybrid type of workflow. But everything starts with the patient and everything ends with the patient. And just before we move on, the CAM is the manufacturing part, and that could either be 3D printing, and we call that additive, because from nothing, we create a model. So it's an additive technique. And when we are milling, we are subtracting from a puck or a zirconia. So that would be the CAM part, which is manufacturing. And everything starts with the patient and ends with the patient. So in our schools, we use an intraoral scanner called Trios. Basically, as you can see here, this video is not to promote their scanner or nothing like that, but it's to show you that as we go, scanners are getting smaller, faster, with the intention of being more comfortable for the patient and faster turnaround times too. So one thing that I teach is after we scan and we acquire the data acquisition, the students and now the clinicians, we need to understand the different types of formats that this generates. So in 2025, if you don't know what an STL file is, you're behind. So everything is, now we say, send me the cast, show me the cast. Now our terminology is send me the STL file. And that's how you communicate with the labs or interdisciplinary with your specialty. So that's a little chart that could be useful. This is what we teach the students. PLY is the same scan, but it adds color and texture. So this could be used when you need to either go through clinical findings or do a digital smile design. So I'll show you an example coming up what's the difference between an STL file and a PLY file. And if we're going too fast, let us know, okay? So this is a patient that came to our practice. So basically what you see right now is the white and blue file. That model is called an STL file. As you can see, is monochromatic, right? And it's blue and white because I chose those colors because that's the color of my flag. But the same scan, if I exported that as a PLY, is the one you see right now on the bottom of the screen. And because that has color and texture, this can help looking through findings, communicating with the patient treatment plan. So this, knowing the differences of what you can obtain after you scan, this can help your practice or your community clinic or anywhere you're practicing. This is a good tool, and you see how the patient's acceptance goes up because now they're seeing what they have and they can understand better. So this tool is definitely important when it comes to one of the advantages of digital. So we went from visual exams, manual reviews, time-consuming research. Believe it or not, I had paper records back then. I might look young, but I graduated 11 years ago, so I've experienced the change, and that's why I repeat and say, to me, it's exciting to be around this era because everything is just a lot easier. So now for digital wax ups, and I'll show you cases. We do a lot of data acquisition. We design. Basically, what we're teaching our students nowadays, and what I recommend is, we are in this moment where you should be able to capture your patient's mouth, gums, teeth, and then get with the CBCT, like a 3D X-ray. You should be able to digitize your patient. That way you can plan accordingly. So the way we like to do things now is that we plan to where we want to get to, and then we engineer backwards and say, okay, how do I get to this? So that is the shift versus before we were kind of figuring it out as long as in the way. So 3D printing has made everything easier. We'll show a case about an implant case and how fast and predictable these have become. In orthodontics, they were the ones leading with this technology. Now we can show the patient how they would look like even before we start treatment. And then what's big right now is the AI-assisted diagnosis. So we're going and we're actually, we're actually pulling up our full mouth X-rays, and these AI softwares are assisting us to look at clinical findings. It's important in that the clinician, the doctor, the student, we are the doctors, and we have to be responsible. We can't let AI take over, but it is a very helpful tool. So again, this is just a little case. I like to throw cases around so somebody that's watching can say, oh, maybe that's a case I have right now, or this is how this could be helpful. So this is a very simple case. A patient comes to our clinic. As you can see, tooth number 8 is periodontally hopeless, but the patient doesn't want to lose that tooth. So if we would have taken an impression like before, that tooth would most likely be extracted in the impression. So with digital technology and scanning, we can obtain the patient's data without even touching the teeth. So this is my student. She's a DS4, Elaine Morrow. This is her case. So we scanned, we 3D printed, and then we gave them an interim partial, just a very quick solution. So that's just a little case of how integrating these technologies can help. This is one of my mentors, Dr. Barji. I do want to shout out to Dr. Barji. So I work with him in the aesthetic clinic, and here you can see how we are designing his smile. And basically this software, this is called Smilefy, allows you to take a picture of your patient, and in 5 minutes, you could show your patient how they would look like if we go ahead and do treatment. So again, that's another tool that can help you be more productive and have patient acceptance. And for our students, these tools are important because it helps them visualize where they're going with the treatment. This is something that we do a lot. This is we're teaching our students how to collect the data, take intraoral pictures, extraoral pictures. And like I said, with the scans, now we have a digital patient that we can design on. This is my student. He allowed us today to show this case. And basically you can see where that we're designing his smile, and we get to the point where when we are happy with the design, we 3D print that model, and we do motivational mock-ups. We show the patient how they would look like if we went ahead and done treatment. So the first video.
Do you want audio for this, or
No,
just the video?
So the first video, you ask the patient, tell me about your day, anything so that we can see. The patient is talking, but I'm not really paying attention. I'm looking at the lip line and size of edge display. I'm analyzing all these things for my design, correct? Then we go to the software, and then we put the design in the patient's mouth, and that's called a mock-up. So you can see here after the design, and we put this in his face, how this would look if he does treatment with us, but now the patient can have it on their face. And it has a greater impact than showing an application in 2 dimensions of how it would look like. Now the patient has it, and it's more rich. A lot of our patients ask me, Dr. Escobar, can I take this home with me? And we say, no, because it's gonna start chipping. It's just there. And then, but we get that a lot, and this is something that you can do anywhere with a scanner and a printer. And this not only allows you to sell a treatment, but also gives you a lot of information as a clinician where you can go with this case.
And when we get to the point of planning, in the past, we were gathering all these diagnoses. We were doing literature review research to realize what was the best plan for our patient. And today, we have a lot of tools that can assist us in this step of our planning. That is also the most important part, right? To actually help the patient understanding what we are thinking about doing with them, and what are their options, the alternatives, and what are the pros and cons of each treatment plan, and also to help them visualize what is going to be the result of the treatment. So today we have a lot of assisted imaging and virtual reality that can help in visualizing the treatment. We have implant, prosthodontics, and orthodontics planning, and Carlos will show us later how do we normally plan an implant in our dental school. And predictive visualization for the patient with mock-ups and simulation. We just saw that there are a lot of simulation also in orthodontics. And integrated documentation for continuity of care. So this is also very important because we can put all like Carlos was saying, we can digitalize our patient, put everything in their profile, and that can help other providers if the patient needs to see a specialist or anybody else. And also we have AI-assisted scheduling and insurance planning. And this is important because we can have at the same time also the financial part of the treatment plan. So the patient knows that this can accelerate their decision. The patient knows what they are going for, and they can decide about their treatment plan faster. Instead of waiting like it happened before, that they had to contact insurance and having the whole plan given to them later, they had to talk with their spouses and all this other time that was in the reality delaying the acceptance of the case. And before we continue with our fantastic cases that Dr. Escobar is presenting, I want to just do a little exploration of the AI and augmented intelligence in dentistry. These two terms are actually different. AI means substitution of human intelligence, so it's an artificial intelligence, while augmented intelligence is actually a tool to help the human work. And so it doesn't replace the human intelligence. It's actually a tool that helps. And most of the AI in dentistry that we have today is mostly augmented intelligence at this point. So it's all tools that assist us in doing our job. In the future, maybe it's going to be mostly AI, very little monitoring from our part. But right now, how the situation is, right now, we really need to monitor these tools. Like we can use them, but we also need to monitor them really well to make sure that they are accurate. So AI in dentistry today, or augmented intelligence in dentistry, is used in different disciplines. Is used in dental anatomy to visual. It's mostly computer visualization, so dental anatomy, radiology, perio, and to visualize the problem and to also do a possible prediction of what this kind of disease is taking the patient and what is going to be the best treatment plan to help this disease to be cured, but also to help with maintenance, oral health with epidemiology. So having a huge patient data system can help in understanding the risks of a certain population and how we can prevent problems happening later. Is used in caries detection. We saw already a lot of radiographic image visualization system that help with the diagnosis. Implant planning, endo detection, pre-treatment planning to see the system, the root canal system, and the prediction of the possible results. Prosthodontics with scanning and WhatsApp and lab collaboration. Ortho with prediction of growth, with treatment planning, facial analysis, and simulation to see how the treatment it will be in the future. TMJ, there are some occlusal guards based on AI scanning, and sleep disorder, and also practice management. We were talking about insurance claims, scheduling, all the part of the note writing, the record keeping, all the part that is practice management where AI can help. This is a courtesy of Dr. Khan. She, not long ago, she did a fantastic presentation on AI in dentistry, and she shared kindly this slide with me. So these are the FDA-approved clinical applications that we have right now available for offices, and Overjet helps in computer vision and insurance claim. Right now, they are working on other functions. Pearl, also computer vision and practice management. Most of them is computer vision imaging, and some of them have some treatment planning part. There is a system that is coming out right now. It's been some time that it's been around. It's called ISAC. It's called the ChatGPT for dentists. It's actually a tool that helps in planning and in clinical decision making. So this tool analyzes a certain data system and basically does prediction on treatment planning or prognosis, and also literature reviews. So that helps a lot with deciding what's the best plan for the patient. This is a statement from ADA that it says like where the actual artificial augmented intelligence based software can assist with treatment planning. And these are all valuable insights and help dentists with their decision. And also have the patient understanding the reasons why we are proposing a certain treatment plan in a visual way also helps with case acceptance, like Carlos was saying. And I found out this little thing, AI Dental app. This actually is very interesting because it's for planning RPD and is used for students. So we will explore that for sure to help the students understanding RPDs. This is a good reading if you want to explore the AI and are planning to buy a system or to subscribe to some system. It's 2 papers from ADA and standards. So this is important for vendors, but also for clinicians, because it makes you understand what are the gate guards for AI the ADA is establishing, but also at the same time helps with understanding what are your responsibilities as clinician when you are introducing this system in your practice.
Okay, thank you, Dr. Riccio. So I'm going to show you, I'm going to walk you through how we do an implant planning case in our school, and basically how we use the different tools. So here you can see how patients missing 3 teeth, we're going to replace them with 2 implants. So basically we do the data acquisition, we get the intraoral scans, and then we superimpose this with the CBCT. So now we have the patient's mouth with their bone, and now we can look at where we're going to put the teeth, but also do we have the bone to do that. So we always start by doing the digital wax up, because we want all our treatments to be driven by the final restoration. So you can see this is a Blue Sky Bio software that you can download for free and start playing around with it. Or if you need help, you can send me an email. I'll be glad to help. But this is a good software out there that can help you do these cases. So this is what I like to do. So you see from left to right, we have the patient's scans, and then we go to the ideal. The picture in the middle is the key. You always go to ideal. Where am I heading? What's my final purpose? And it's to replace the missing teeth. After you do that, then you go backwards. You say, how do I get to that? With these tools, you can plan everything outside the patient's mouth. But this makes the actual visit a lot. It makes it shorter visit, less painful for the patient, less time in the chair, more efficient for the doctor. So we've gotten to the point that if you know how to treatment plan these cases, they go ahead and work smoothly. So the next slide would be how we use the surgical guide. I tried it on a printed model first. Basically, your scan should replicate exactly the patient's mouth, and you can see that if it fits on the printed model, I am secure that that's going to have a good fit. And now I'm just drilling through these guides. There's no chance of me tilting my hand or moving it, and I'm placing the implants exactly where they were planned. And then we put the implants, take the impression, send to the lab. This is the lab sending me this file and say, Dr. Escobar, can you review our design before the fabrication? And this is one of the advantages of us digitizing the workflow, because now we can communicate through an email, through a Zoom call, Zoom meeting, and basically make sure that we're all on the same page. Versus before, maybe the lab would have to wax it up, send it to you by email, by mail. The wax may be melted in the car, and then all this back and forth that was definitely a headache. So this is just the case how we go from planning, from data acquisition to planning to executing, and we can see how the outcomes are more predictable. And that's the main goal. The main goal is how can I make my patient's experience better? Because absolutely, you're competing with all these dentists that are definitely looking into this. So you have to stay on board, and you can see the 2 implants healed, how the 3-unit implant supported bridge was on the cast, and basically how that translates on the patient's final restoration. That's exactly what we planned from day one. And these technologies help us get there a lot easier, faster, and more comfortable for the patient. I did want to share this slide, just get you a little bit excited of what's coming. I want you to pay attention here to this video. Basically, this is, we are in the digital symposium this year, and you can see how planning is now going to be with, everything's going to be virtual reality, and with just you utilizing your 2 fingers, we're going to be able to do treatment planning, implant planning, digital smile designs, communicate with the patient. So this is where this updated software is going to come out pretty soon, and I'm excited. This is what I want for the school and for our students. We definitely want to lead, and this is where we're heading. In this picture, you can see Dr. Bonilla, Dr. Thais Phillips, 3 of us represented UT, and then Dr. Blatz, which is an amazing doctor in the field of dentistry.
So trying to go towards the conclusion, we realize what are after what we talked about, what are the real benefits of integrating these digital tools in treatment planning. So for sure, there is going to be a faster planning, more accurate, and there is a faster communication and better communication with labs. And there are, again, fewer errors and remakes, because digitally we are more precise. There are less steps in between. And also there are less problems with the communication with labs. So that also helps in having a better result. There is an enhanced collaboration and data consistency across teams. So even when you are working with a specialist or you are working with interprofessionally, there is a better collaboration and a better communication, and improves prognosis and decision-making by adding data-driven AI analysis and algorithms. And also that can help in calibrating providers among themselves, and also calibrating providers and patients. So having the patient have clear expectations of what they are going to be treated for. This is very important for a good outcomes with patients.
Yep. So another of the benefits out of hundreds of benefits that digital brings is it does improve the patient communication and acceptance. I've been saying treatment acceptance is going to go higher because it is. The patient gets to see and visualize what's going on, and helps them understand why the need of that treatment. So it's a great tool to scan. You bring the patient in and you show them the findings, and you walk them through their options. This is important for our school as we seek to be leaders and to have the best students. I'm part of the committee that interviews our incoming students, and we know how attractive the digital workflows can be for them, as it should. And this is important for us to stay on top and make them want to come to our university. And then the last but not least is there's a lot of studies that have proven that yes, these tools, these hardware softwares may have a initial cost that could be important, but long term you will reduce waste materials, have a higher treatment acceptance. Patients will feel more comfortable. Maybe you can do treatments faster and be able to treat more patients. So in the long term, this is important. I think one example that comes to mind is there is a law here in Texas where we have to keep models or master models for 5 years. And don't quote me on the years, but it's an amount of years that
5 years. I think it's 5.
Okay, it's 5 years. And now you have to have a room full of models where with digital, this would all be in one, in your computer, in one cloud, in one space. And then you can use that space to have another chair, 2 or 3, and be more productive. So that's like an easy example of how that can translate.
Yeah, and if I can add to the new graduates, since you are doing an amazing job in training them from the first year to the 4th year in the digital workflow, when they get out and they want to join a practice, of course, they're going to be more attracted to a practice that has a digital workflow. So, you know, and they can also help you in modernizing your practice if you are not already completely digitalized. So I think this is a great job that you are doing and we are doing as an institution to bring the students in this actual world where digital is right now part of almost every practice. And if it's not, it's important to explore it because you want to really keep up with what's happening out there.
I do want to take the opportunity that this is not a one-man show. I'm very thankful for the team, the digital committee. Everything that was learned was through my residency program and all these mentors. But working in collaboration with the course directors and how we're implementing this in the curriculum has been an amazing experience. So I want to thank everybody for that.
And you know, talking about in general, knowing that DenTecho is also for community outside and rural community. I want to show how digitalizing your practice, as I said, as Carlos said, even if it has an initial cost, can actually benefit all the population. So in rural communities, having a digital workflow reduces the time that the patient, you are seeing the patient, reduces the time the time that the patient needs to take out of work. So it's also less expensive for the patient as well. Shorten lab-related procedure, all the mailing part, and also accelerate the treatment delivery for the patients. Different ages. So digital tools are used also in pediatric dentistry and geriatric dentistry, and they help a lot because they're less invasive, especially in the first encounters with the patient, and increase the engagement and the behavioral aspect of the patient as well. And patients with complex special needs, that simplifies appointment, can help with virtual visualization and reducing the anxiety. The treatment plans can be customized and individualized for this type of patient. And you also can train your staff in simulated environments so they can be more prepared to address cases that require special attention. And improves continuity of care across providers and location. In our public health, we were talking about epidemiology and how you can really create the plans for preventative plans for community needs. And overall, the impact, it creates a better efficiency, patient engagement, leads to faster and more accessible and high quality care for all population. And I want to show some slides that Dr. Contreras, pediatric dentist, shared with me. They are using this intraoral camera for pediatric patients, and they are really having a lot of good results because the time that they have with the patient is very limited, and so they can re-look at the camera and for a better diagnosis and treatment planning. And special needs, Dr. Kaur and Dr. Soto, they shared with me this work that they did with dental students, where they were training them in a virtual environment for special needs patients.
Yep. This year we had the opportunity to work with Dr. Soto, Dr. Kundapur. We had a selective that was our 4th-year students were here for 1 week, and we went over techniques where we can go over the workflows for digital dentures, scanning and all these digital procedures. When we have a geriatric patient, definitely helps and benefits. We need to short those times in the chair. We need to make sure that we can reduce the amount of appointments and make it feel comfortable for our geriatrics patients. So here you can see how we went over the workflow, and this is something that I want to thank Dr. Soto for having the initiative and inviting me to lecture them. So thank you. Okay, so I get asked a lot, Dr. Escobar, where do I start? What equipment do I buy? I think I'm going to give you some steps how to integrate, but make sure that everything you do, you do it with a purpose. And first, you got to assess current workflows and identify efficiencies. Like, where am I wasting material? Why is my appointment's taking so long? Why am I redoing so many crowns? Is it something that I can do better? So everyone asks me, what scanner do I buy? And basically, I'm gonna be honest, in 2025, all the scanners are pretty good or good enough. But if you have to look into it, read about the accuracy. Accuracy is how efficient and how good that scanner can replicate. But the sales rep are going to tell you about speed and cost, and that it doesn't have a wire, and all these things that really don't matter when it comes to this. So I would always look into accuracy. When you use AI tools, and this is what our main focus as educators is that we make sure that we, first of all, are strict with cybersecurity. Remember that these are patients that we have to respect and go by our HIPAA laws. So if you're going to use AI, you got to use it responsibly. For example, our workflow in the school is we don't use patients' information at all. We go by their chart number, and that helps us stay compliant with the tools. We got to train the staff. It all starts with the staff. So make sure that if you're thinking about integrating, I have CE courses, and I'm not selling myself, but what I'm trying to say is, to my courses, there's doctors that send their assistants or their staff to get trained so that everybody's on board when they come back. So I think that is well spent. It's necessary for you to spend money on this so that you can see long term. And then pilot implementation, select cases, start small, as we do in the clinic. Every time we want to implement something, we choose the correct cases, we identify the workflow, we make sure that we are using scientific based information, and once you start doing a few, then you can expand. Monitor the accuracy of the systems you use. Always make sure that everything is calibrated, that everything is up to date. You don't want to be having to do redos because you're not calibrating, you're not looking at what's going on with this equipment. So remember that maintenance is important as well. And then measure the success of what you're doing through the workflow speed. Is my workflow getting better? Are my patients satisfied? Make sure that you're reaching towards your end goal, and you're not just trying to integrate digital just to say that you're digital, or you have a digital office. Make sure that the final purpose, it should be patient outcome, and take care of your patients, and then how it can benefit you as a clinician as well. So basically that is what we had for you guys today. I know everyone has somewhere to be pretty soon, but we're open for any questions.
Thank you so much, Dr. Richo and Dr. Escobar. That was a great presentation, and thank you for sharing so many helpful examples and cases as well. Any questions, any comments on the Learning Network?
Thank you, Mishra.
Thank you.
Bye,
Thank you so much. Great, thank you.
Please feel free to drop any questions, comments into the chat. And I see a lot of thank yous. Very informative, a lot of people are saying.
Especially with the cases, Dr. Richo and Dr. Escobar. Very helpful.
I'm glad.
Yes.
Yeah.
We've been preparing for this 9 months.
A lot of hard work went behind
a
that.
delivery of a baby.
Well, if no one has questions, you can always reach out
Yeah.
on our emails,
Mhm.
and I will be glad to reply as soon as possible.
Let me put our email.
Our emails are right there on the screen, I think. Do we stop sharing?
Are we still sharing?
It's not sharing. But you can you share if the
Our emails are right there.
Yeah.
Perfect. And today's session was recorded, and as Ms. Kawasaki mentioned at the beginning of the session, and it will be available within a week, if not next week, definitely after the Thanksgiving break, for all of you to review if you want to go and revisit the presentation. I will. It was a very informative presentation.
Thank you, and you all be safe and have a good day.
Thank you so much.
Bye-bye. Thank you.
Thank you, everyone.
We
and-
do have the post-assessment.
Session, yes. Survey, the link will be dropped in the chat.
Mhm.
And yes, thank you, Maria. And then our next session is in the next year. So we'll hope to see you in the new year. Thank you again, everyone, for joining, and then have a great rest of the day.